I'm Dr. Nisreen Alwan. I'm an associate professor in public health at the University of Southampton, and I'm also an honorary consultant in public health at University Hospital Southampton. I work with public health teams, across Hampshire, public health trainees, so really more in a service role in terms of, working with public health to improve outcomes, regionally and nationally as well. So I focus on the area of maternal child health. So I look at pregnancy, before pregnancy, and kind of even between pregnancies. So really the health of the mother and the family, and look at what we could change, what's modifiable in that time, during that time, whether that's things like smoking or nutrition, or other factors, but also the barriers and facilitators for these behavioral factors, so looking at inequalities in terms of socio-economic inequalities, and environment around the family at that time. I was always keen to particularly look at the field of maternal child health. I'm a mother myself. I've got 3 children, so I've kind of lived the experience of pregnancy and what that means, and how it's important time point, and how then the health of the child and the mother's shaped by that later. So I trained in medicine, and then I trained in clinical medicine, and then I went into public health training as a kind of a pathway within clinical medicine training. And then I went into, I really was keen on the academic side. So then I did I did a PhD. I had a fellowship and I did a PhD to do that, and then went into academia. It's like every day is a different day in research, because there's always new ideas and new challenges. You move from one thing to the other. You always have to actively think how to tackle problems, or solve problems. It's really nice to work within a team that where the people are motivated to do the research, answer the questions, and have that kind of really great debates with them about where the research can go, where the potential of the questions. So I like that aspect of it as well. And then there is the wider team of people outside your group, even outside the university, your international partners, and how you work with them and exchange ideas and collaborate with them. So it's a moving thing. I've got my own team, but I think I'm also thinking about the wider team of the people I work with. The University of Southampton's got a wide range of disciplines to work with, particularly for us in public health, because public health needs to be multidisciplinary. We need to work with people outside medicine, for example. So we work with people at, geography and psychology and demography, social statistics and business, really quite, wide ranging, because we focus not only on, healthcare, but the wider determinants of health. So Southampton is very rich in that, is that there are strong teams in the different disciplines and the different faculties of university. So it allows us to work within that kind of rich environment. I think the nice thing about the academic post is there is really no typical day. It's the job is nice in that it's really flexible in terms of what is in your day. Attending lots of kind of talks and seminars, and talking to people about your research. It's the normal human qualities that you would want in any colleague at any job, really, to try and listen, be kind, be compassionate, understand, work well with other people. We're very much trained to be critical in every step. We always have to have in mind that positive feedback, telling people if they do well, generally speaking, is a really important part, really important part of being a good scientist as well. The awards I got made me feel good and motivate me to do more, to more science, to serve, the community more. And I think that's the general principle.